So my name is Mario Pacheco. I'm a family doctor. I apologize that I cannot begin to meet the shoes that Dr. Arthur Kaufman, who was unable to be here today. But I will share with you some very interesting things that we've been doing in New Mexico. The way that we change education is by changing our institutions. And the University of New Mexico Health Sciences Center has made a very bold statement in its Vision 2020, which is the University of New Mexico Health Sciences Center will work with community partners to help New Mexico make more progress in health and health equity than any other state by 2020. So this is a very bold, measurable vision that we are trying to work towards. The chancellor of our Health Sciences Center went around New Mexico and found some very interesting information. The communities where he went to talk to thought that it was important for us to overcome an image of this being the University of Albuquerque, which is where the University of New Mexico is located. Albuquerque is the largest city in New Mexico, and so the implication here is that the University of New Mexico was serving more the needs of Albuquerque than it was the rest of the state. And another comment was that UNM is only present in the community while the grant funds last, and then we're gone. They felt that UNM needed to commit to long-term partnerships, not just grant-funded programs, build upon the local wisdom of leaders, organizations, programs. They wanted an easier way to communicate with the university and not get the runaround being told to call different numbers. And this was possibly one of the most painful, was to have a full-time presence in all communities, like New Mexico State University in Las Cruces. It's a land grant university. And I'll explain a little bit more how we've responded along those lines. So it turns out that we're not completely unique here. Across the nation, there's some comments here about universities and community engagement. But the comments made by these communities are very similar to some of these more national comments. So our chancellor responded by establishing an office for community health. Dr. Arthur Kaufman is the vice chancellor in this office, and the goal of this office, where I serve as the executive director for Hispanic Health, the goal of this office is to build bridges with community partners and to provide programmatic efforts guided by the extensive community input. So at the University of New Mexico, we have a long history of innovation. This is a listing of some of the time frame. I started medical school in 1982, and I was one of the experimental students in this problem-based curriculum. I'm a good example of growing your own. I've then become part of the innovation down the list here. I learned in medical school in small groups, problem-based groups. And then I did my residency in family medicine and started working at a community health center in Santa Fe, in Nuevo Mexico, where I was the founding director of a family medicine residency program. So you can see in the timeline here in '92, we started working on changing residency education. And so I'm going to talk a little bit about this today because that's what I was most involved in. I'll very briefly talk about integrating public health and medicine, and then I'll probably spend most of the time spending about addressing social determinants of health and disease. We used to have in New Mexico just one family medicine residency program. And we only have one medical school. There are now 100 students in each class. So from Albuquerque, we would train students, some of who would go into family medicine, and then of those that went into family medicine, most of them would stay in Albuquerque. So we started a number of decentralized residency programs. I was the director of the program in Santa Fe, up in the more northern part of the state. But we also started a program in Roswell and Las Cruces, with the university being responsive to the unique needs of those communities. For example, we all started off with the idea that we would start these residency programs in community health centers. Well, of the three that we started, mine was the only one that actually ended up being in a community health center because of different needs of the community. And so the university was receptive to the different needs. So at this point, half of the family medicine residents that we train are trained in Albuquerque, and half are trained in these rural programs. And it's significant just to note that of the Albuquerque graduates, 25% work in rural areas. Of the residents that train in the decentralized programs, over 70%, 85% in the Santa Fe program end up working in the rural areas of New Mexico. So I think this is an example of the responsiveness to the needs of the state. This was mentioned a little bit earlier. One of the innovations here, a requirement that every medical student have a public health certificate that's incorporated into their training, both in coursework that is block schedule type, and then also just also spread out throughout the longitudinal curriculum during the School of Medicine. We hope to integrate this in the future also into nursing education, other allied health education, as we look at the possibilities of starting a School of Public Health at the University of New Mexico. So this is what I want to spend most of my time talking about. As we look at the determinants of health, in the United States, we spend most of our money on health services. That's where 91% of the national health budget goes to. Yet it contributes very little to the mortality, especially relatively speaking. When we look at lifestyle, biology, genetics, environment, those are much larger contributors to mortality, but we spend a significant less amount of our national health care budget on those items. I was very interested to hear the Minister of Health talking about the collaboration with the education of teachers. Maybe we could have more impact focusing on those kind of possibilities. There's an increasing need for new models of care. When you look at the top 5% of care users, 50% of the resources are used up by these 5%. And many of these issues are related to social determinants, behavioral issues, and substance abuse issues. So we have to be able to manage these patients in a collaborative fashion between medical, behavioral, social, and other community outreach resources. This is a measure of the social health of the 50 states. It's actually 16 different social indicators that are represented in different parts of a person's life, including child poverty, teen drug use, unemployment, suicide among the elderly, food stamp coverage, and you can see at the very bottom there is where New Mexico is. So we have problems in New Mexico. We're a rural state, don't have a lot of resources. We rank very, very low, just as low as you can go in the United States. There are only 50 states, so that's the joke here. We also know from our information from our New Mexico Department of Health that quality of care is not enough. For example, when you look at the recommended preventive services, Native Americans, we have a lot of Native Americans in New Mexico, make up almost 10% of our population. They have the absolute best rates of complying with these recommended preventive services. Yet, they have the highest rates of death from diabetes. So there's a disconnect here. They get the best recommended preventive services, but they have the worst outcomes. We know that education and health, there's a strong correlation. If we could move some measures like the educational attainment, we could have a larger impact on health and putting more money into the healthcare system. Also, food deserts in New Mexico, these little circles represent 20 miles, I believe, the larger circle to reach a grocery store. You can see a lot of areas where there's no circles. That's how far some people have to travel in rural New Mexico. Now, granted, there's not people in all of those places. There's maybe some cows there, but the point being that there are areas where the access to food is not an easy thing. So things as basic as education and food access are areas that we should care about as healthcare professionals. So getting back to what we heard from some of the people as the chancellor traveled around the state. In the United States, every single state has a land-grant university. And these land-grant universities have outreach offices into every county of the state. And so these are the 33 counties in New Mexico, and you can see the little dots. That's where the agriculture agent is stationed for each of these counties. So they will deal with a variety of things that are predominantly agriculture-based. And they drive around in their New Mexico State University cars, and so they have a great presence in the community. People know them. They'll call them up when they're having a problem with the crop or some disease in their animals. And so the communities know these agriculture agents. And so we started thinking how we might be able to integrate this type of approach with the healthcare system that we need to be addressing. So we've established health extension rural offices based on this agriculture model. We haven't had the funding to place a health extension rural agent in every county yet, but we're up to almost 16 now. Some are funded by hospitals, other sources of funding, but that's our goal in New Mexico, is to have a health extension agent in each of these counties ultimately. And the role of these heroes, we call them, is to link the community health priorities with the University of New Mexico resources. And it's really amazing to consider how different our perspectives can be from what the community needs and what the university thinks that the community needs. So this is an example of this, of one of these counties, one of these heroes down in the highlighted area, which is Hidalgo and Grant County. So you can see it's just about as far from Albuquerque as you can get in New Mexico. And what this county asked for is, they said, we need help training community health workers. And there's a number of other things, but I want to use this example of them wanting help training the community health workers as something we probably wouldn't have thought of at the university. And so, responding to the needs of this rural county, then the heroes and the area health education center personnel are partnering to train community health workers, a variety of things that they worked out with the community, things like motivational interviewing, how to identify community resources, and so forth. So everyone here, I assume, is familiar with community health workers or promotoras. And so we're really formalizing in some ways the existence of these community health workers in our system of care. So again, when you look at the land-grant universities having the agriculture agents in each of the counties, these agriculture agents bring certain skills with them too. There's something called 4-H. I don't know if that exists here in South America also, but one of the H's stands for health. And so these agriculture agents also have a lot of skills and knowledge which they can actually partner with these heroes and with the university to do some joint nutrition classes, for example, some economic development, the honey, eggs, chicken plants, some of the other issues that we typically don't know a whole lot about as trained healthcare professionals. So this is, I think, an area that we have a lot of hope for. We have a lot of expectations. It costs money. We were able to, through a process of advocacy, we were able to include this in the Affordable Care Act that was passed a couple of years ago. Unfortunately, it was not funded until after our legislature switched to more conservative makeup. And so we were able to get some seed money, some pilot funding. But the hope is that we can influence a change over time. There are other states within the United States that are very interested in pursuing this same approach to a decentralized responsiveness to the needs of the community, which is going to be very different within New Mexico. Even the needs of the northern part of the state and the needs of the southern part of the state are going to be very, very different. And so we have to be responsive and, as a university, meet the needs of both the northern and the southern part of the state. So how does this influence what our research priorities are? Well, we can just imagine what we usually identify, and these are actually the UNM Health Sciences Center research priorities, and they seem like very reasonable research priorities. Cancer, cardiovascular, metabolic disease, brain and behavior, infectious disease, and immunity. You ask the county health councils what their priorities are, and yeah, they're kind of consistent, but they're at a much more basic level. And if we just do these research priorities that the university has identified, the community is not going to see it. But they identify substance abuse, teenage pregnancy, obesity, access to care, violence, and diabetes. So if we're left to our own devices at the university, we're not going to connect with the community here. So as we decentralize then and have these heroes, we, at this point, since we can't have one in every county, we have some regional heroes. We can hopefully integrate the input from these regional heroes to affect the research priorities of the university that is a little bit more decentralized from our world in Albuquerque. And this is an example of how we're trying to hold ourselves accountable. We can measure the number of primary care physicians in the state and where we rank in the country. And so we know exactly what it's going to take to move ourselves up by 3 states, for example. Same thing with high school graduation rate. Not typically something we think about when we're thinking about health status, yet it has a huge impact on the health outcomes. So if we focus on things like the high school graduation rate and start creating new approaches to partnering with communities. This is how we hope to influence the health of New Mexico. Thank you very much.